Today on Ask Your Music Therapist, I want to answer the question, what makes music therapy clinical? It's a really great question, and it helps us really understand how music therapy is different from music education or entertainment or other ways that we might use music in our lives. So the clinical process in music therapy, it's 4 stages, and they kind of go in a circle, really. So stage 1 would be assessing our client. So when we start working with a new client, we want to determine what are their strengths, what areas are weaker, what skills or needs can we address in music therapy. Usually this process would involve input from the parent or the family member. It could be consulting with other allied health professionals, so we'll often work collaboratively with speech therapists and occupational therapists and physiotherapists. So gathering all that information and then looking at what we're seeing in our musical environment. Usually our assessments take anywhere from 1 to 3 sessions, and once that's done, we're ready to move on to stage 2. And this part is where we develop our treatment plan. In the treatment plan, we want to determine what are the goals that we're going to work on, what are the specific objectives within each goal. So for example, the goal might be working on communication skills, and then the objectives will be smaller, measurable things that we can be addressing in our sessions. And the other part of the treatment plan is really looking carefully at how I, as a music therapist, can make sure that I'm creating musical experiences that are going to set the client up to work on their goals and to ultimately achieve their objectives. So stage 3 is where we implement all of this. So each session we create a plan on all the different things that we're going to do that will really target all of the goals and objectives. We want to make sure we're touching on them all every single session. After the session, we create our session notes where we're evaluating what did we see in our client today, what strategies that we used worked well, what maybe didn't, what will we try differently next session. So we're constantly looking at how we're helping the client achieve their goals. And then once we've been working on our goals for a period of time, usually it could be anywhere from 8 to 10 or even 20 sessions, then we have stage 4, which is the evaluation and feedback. So during this time, we would take a look at, has our client achieved their goals and objectives? And if so, we need to create new ones. And so that circles us back to looking at the next things we can be working on. And it's a cycle. So often with our clients, we'll continue to work for periods of time and we just keep moving the goals to something new. Or others, maybe the goal was to help work through some emotional trauma, and perhaps after a period of time, the goal's been achieved and we can discharge them from therapy. So I hope this clarifies for you how music therapy is clinical. And I look forward to answering all your other questions. Please put them in the comments below, and I'll be back next month with another Ask Your Music Therapist.